course, the new spike in COVID cases is what is causing many businesses and schools to tighten up again when it comes to masks. Rules regarding when to wear them, we know, have changed several times over the past year and a half. So to talk more about that, let's get out to WCNC Charlotte's Chloe Leshner, who's joining us live from Northwest Charlotte. So Chloe, seemingly a lot of folks thinking here the CDC's messaging on all this is very confusing.
Yeah, definitely, Vanessa. And the COVID testing line here at StarMed has been long all day long. It's why the CDC, Governor Cooper, and Mecklenburg County health officials want people to wear masks in public again. But it's not a mandate, and the CDC's messaging wasn't necessarily clear or direct. So actually influencing people's behavior can be a challenge.
After months of moving in the right direction, the CDC is recommending areas with significant COVID transmission take a step back, and everyone, fully vaccinated or not, mask up in public again. The changes giving some whiplash.
It's kind of weird going from no one wearing masks at all. It seems like just a weird backstep.
The evolving guidance isn't necessarily the problem.
This is a new virus still for us, frankly. Because of that, this will continue to ebb and flow in ways that are hard for us to predict, try as we might.
But the CDC has a communications crisis. Clear messaging key in influencing the audience's behaviors.
It's super important to be mindful that your audience is probably a mix of people with a variety of backgrounds and availability to receive your message.
The latest announcement on changing mask guidelines was vague and didn't point out the specific areas in the country most at risk, leaving many wondering if it applied to them.
It is very confusing when you do mass messaging that has a lot of different rules for everyone. So I think going back to a blanket message of let's just set some guidelines.
Corey Smith owns Black Wednesday, a local public relations firm. She says there's still opportunity for the CDC to redirect its messaging.
I think if there was some of that authentic leveling with people to just say, like, maybe we didn't do it right, and here's what you guys need to know. I think that could go a long way.
She also thinks partnerships could help. For example, she thinks if the CDC partnered up with the Small Business Administration, they could get that important information to local businesses who could better communicate what their employers need to know, and they probably would have some more influence over them too. Live in Charlotte, Chloe Leshner, WCNC Charlotte.